Hi, everyone, and welcome to Wellness Unscripted. I'm Kara Merrick, a functional medicine nurse and the owner and founder of Unscripted Clinic. Today, I'm thrilled to be joined by Dr. Andrew Winger. He's a leading chiropractor and the brains behind Lakeside, Spine, and Wellness. Dr. Winger is not just your typical chiropractor, he's really pushing the boundaries of what chiropractic care can do. So he focuses on a biostructural connection, exploring how we can optimize the body's neurospinal pathways to really unlock better health and function throughout the body. So if you're interested in that and learning how to optimize your health even better, you're in the right place. So welcome, Dr. Winger. Thank you for being here.
Thank you. Love to be here. It's great. Thanks for having me.
Yeah, of course. So I want to start out with just finding out a little bit more about how you're different. So many people are familiar with like the aches and pains that won't go away, right? There's if through injuries or whatever else. Chiropractic care can often be misunderstood. There's often a stack 'em and crack 'em kind of paradigm with chiropractors, but I know that there's so much more to that. So could you tell me how you would address the people who see chiropractic care this way and how you would highlight the deeper benefits of a more holistic approach?
It's more of a traditional approach to chiropractic, and there's a corrective approach. So my specialty is more on the corrective approach side. Traditional's great. Focus there is mostly on improving function. So joints of the spine can get injured and stuck, fixated, locked up, not moving properly. And that can affect neurology, and it can affect, can cause pain. So adjustments help to unlock those joints and lessen people's pain, and it does improve neurology as well. So when joints of the spine are stuck, it creates abnormal signals into the spinal cord that causes what's called disafferentation. That's where pain signals come in. It also bombards the spinal cord with all this different junk that changes neurology and can actually change the function of our nerve system, in particular our autonomic nerve system. So it can lead to other organic issues that occur. So like chiropractors will see, the patient might come for back pain, they might see improvement in their bowel function, other miracles of healing that happen. And then joints that get stuck can over time degenerate, and that can lead to classic, type pinched nerve stuff, right? Like disc herniations, bulges, bone spurs, things like that. Corrective approach, we look more to correcting posture and structure of the spine. So not only will those joints be fixated and stuck and not moving properly, but they'll also be, out of position, or whole body regions like the head, the rib cage, and the pelvis that are shifted and displaced from normal. And that puts increased load on the spine. And that can exacerbate or accelerate that degenerative process, leading to more like a classic compression type nerve. But other issue with shifting in posture really can create stress on the spinal cord, create tension on the spinal cord. And I always say, a corpse has a brain and a spinal cord. It just doesn't have the energy that flows through it, right? And that energy really is health, and really is healing. And stress on the spinal cord can alter the tone and alter the flow, basically, of that life and healing energy in the body. So having a combined approach, really, of improving function and improving structure, I think is a wiser way to practice, and a wiser way for patients to address their spinal concerns. Just addressing the functional side, you're going to miss a lot of that structural issue that is still going to remain if you're not addressing that structural problem.
Right. Yeah. I like to think about how there's main arteries that are bringing blood and nutrients into your brain that need to be working well, but there's also the lymphatic system that needs to drain out all of the the byproducts and the metabolites that can get built up in there too. So it's bidirectional. And if there's any kinks in those hoses, it can lead to real problems that you're noticing every day, or more problematic sometimes are the slow progressive losses in function. So maybe you're not thinking as clearly as you once were. Maybe it presents as, tripping more, or I mean, there's any number of things, mild headaches or anything like that. So it's
Sure.
yeah, everything needs to communicate with each other. We're all interconnected.
Absolutely. Absolutely.
So you mentioned that somebody might come in for back pain and get that corrected and then leave with better bowel function. Can you expand on that a little bit more and maybe talk about how the health of the vagus nerve is really integral and often can be overlooked? It's kind of doesn't get the spotlight that it deserves sometimes.
Yeah, yeah. Yeah, you mentioned that's the literal connection from the brain to the gut, right? The vagus
Mhm.
nerve. Um, just so our listeners are aware, that's a nerve that comes from the brain, it's a cranial nerve, um, exits through our skull, and then runs all the way through our body down to the rectum. And that's really the main player in our autonomic nerve system, and particularly our parasympathetic system. So our resting, digesting, repair and development side to that. So um, the vagus nerve really is a communication pathway from the gut to the brain. And so when there are gut issues, that afferent sensory input back up into the brain through the vagus nerve really creates this cycle of an inflammatory issue. So some things that uh, will occur due to that that vagus response to the brain from abnormal gut function. It'll be it's going to increase motility in the gut, increases gut sensitivity, disrupts the there's cortisol that's secreted that causes inflammation, and that disrupts the GI lining and the barrier of our gut. Can create a leaky gut type situation and autoimmune issues that come with that. Um, and then yeah, it's just and then the inflammation is there to bring macrophages into the system to help in healing. But it creates this pro-inflammatory state, and like I said, it's really cyclical. There's a really cool study with psychobiotics. Have you heard of that?
Tell us about it.
Yeah. So psychobiotics are good bacteria, basically. So they studied that it's taken mice, and mice that have apparently depression and anxiety. They give them good, healthy bacteria, and their symptoms of anxiety and depression lessen. But then they cut the vagus nerve, and when they cut the vagus nerve, those improved state of less anxiety, less depression goes away. So oftentimes when I say it's really the neurological component in our lives that gets missed from a complete diagnosis.
Yeah.
The way that we develop is neurologically first. Right? It's our central nervous system and autonomic nervous system. We're built from below up and then forward. So what I mean by that is first thing that develops is the brain and the brain stem and spinal cord. And then back to the cerebellum, so motor function, and then gut and immune function, and then our brain function because it go forward to the prefrontal cortex, so cognition, behavior, etc. But a lot of times, if there's stress early on, we'll especially see that in children, right? Especially with like on the autistic spectrum, you'll see that right through that development. If there's early and often stress, it can be maternal from the mother, emotional, can be chemical stress in utero. There can be physical in utero constraint that can cause neurological damage, or oftentimes the birthing process itself can cause injury to the brain stem and spinal cord. And these injuries might be undetectable medically, and because they're not really going to show up necessarily on the neurological tests, maybe, but it can be injury to that brain stem and spinal cord, particularly in the upper cervical spine, and that will delay that developmental process. And that's when we'll see motor issues, gut issues, immune issues. And so sometimes focusing on just correcting those, say someone has a gut issue and you're just focusing on and what always needs to be done if there is a gut issue is, supply proper bacteria, help in diet, things like that. Always has to be done, but oftentimes we might miss that neurological component. And missing that neurological component is going to lessen the amount of healing that's going to occur in that person or in that case.
Right. That's one of those things that the best diet and exercise in the world can't, it's going to lower the ceiling if there's a structural problem there that's not being addressed.
Exactly. Yeah.
Yeah.
Not all cases of motor and gut, well, probably all cases of motor issues are neurological, but not all cases of gut and immune issues are neurological per se, but those that are and are missing that component in their care are missing a key to healing, really.
Yeah, I feel like this could be a highlight too for leaky gut. So, I mean, we all have our functional protocols for treating leaky gut, and it's, that's a lot of the probiotics and removing triggers and reducing inflammation and stuff. But that could also be a missing piece for those that have gone through all the protocols and still aren't getting that next stage of healing, is to think about the neurologic piece and maybe look at some things.
Yeah. So I studied 50% of people that suffer with IBS had early life trauma given to the spine. And
yeah, interesting.
And it's a definite direct link to neurological issues with the gut, and the vagus nerve, of course, being the main player in that.
So people probably, this is an assumption here, people probably aren't coming to you directly because of gut issues.
No,
that's probably often a secondary thing. So is that one of the most common things that you see coming in that has a positive effect from realigning the spinal malformations? And
yeah, I would say one of the more common, well, like you said, patients will usually come for traditional spine problems, back pain, neck pain, headaches. Even when I ask them, I'll even tell them, look, you may have a spine problem. Spine problems can be nerve problems. Nerve problems are energy problems. Energy problems create other health conditions. So what else is going on with you?
Yeah.
They still will not divulge to me what's going on with them. Okay. So down the road, it might be, oh, wow, I'm not constipated anymore. Okay, well, I didn't know you were constipated, right?
Yeah.
I'm not treating that, but like I said, as we improve the function of the nerve system, other stuff happens with the body. And so, yeah, it's usually a situation where I'm unaware of what's going on. If someone's able to divulge some information, then I can help them, maybe more nutritionally and give guidance with things like that, or specifically look to areas of the spine that maybe I could miss based on their symptomatology. I don't treat those symptoms, but it can give clues to what might be going on with their spine and their nerve system, or where there might be interference to that.
So you mentioned this a little bit, but can you talk a little bit more about the other interventions other than just doing spinal corrections? Talk a little bit about what nutrition things you often see coming up, and just some themes that you're seeing in your practice that you tend to talk to a lot of patients about.
Mostly I give guidance on anti-inflammatory because it's inflammation that's really the driving factor in all these chronic conditions, including autoimmune issues, and then of course just guidance on getting healthy bacteria into the gut. I feel from what I've read and learned that fermented vegetables are the best route to go to getting those good probiotics, but mainly focus on anti-inflammatory diet and then getting the essential nutrients that our body needs. So those nutrients that our body doesn't make, we've got to get either by the sun or by our diet.
Can you elaborate a little bit on how the spine and the immune system are connected?
We've always kind of, actually historically chiropractic, we've always kind of thought there was a connection, and medically they said there is no connection. But now I know there are, and it's not direct, nerve, like a muscle, nerve synapse to that muscle connection, but it's in receptors and uh, so a different route than synapse to synapse, more of a like a glandular blood situation. I don't even know how to explain it, but there is scientifically now connections between the nerve system and immune function.
Yeah. Yeah.
So,
One of the things that I think about a lot is the neurotransmitters. I have a lot of clients that are struggling with anxiety and depression, and I always talk about how the neurotransmitters are heavily influenced by the nervous system and
yeah.
the gut.
Yeah.
Do you see clients kind of like the gut issues coming in and saying, "Hey, actually, my anxiety is a lot better too"?
Oh, yeah, absolutely. I had a patient just the other day that wants to lower her, is ready to lower her anxiety and depression medication. More of what we'll see through that is it's gut issues, and the leaky gut eventually lead to breakdown of the blood-brain barrier into leaky brain.
Mm-hmm.
So it's really all a continuum of one condition. So I think that's most likely where we see that improvement in anxiety and depression. I don't know if it's, I don't know how to explain that through neurotransmission, but more of along the lines of that inflammation. Just adjustments themselves are, there are studies that show they decrease pro-inflammatory cytokines, so they decrease inflammation. I think that's probably, in my opinion, the main route.
So the other thing I was thinking about is when you have clients come in for chiropractic adjustment, just kind of like massage, where it tends to shake up a lot of toxins and stuff that have been stored. Do you see the same kind of effect with chiropractic adjustments?
Not quite like massage, because massage is really getting in and moving a lot of that blood and lymph and things like that. I mean, in chiropractic, we'll see, small percentage of people are sore, with initial care. Really don't see that massage type of
The
issue.
effect, yeah.
Where you have to, when you leave massage, they say, drink plenty of water, flush all those toxins out. Adjustments aren't creating that amount of toxin in the body.
Disruption, yeah. What, in your practice, what are some of the signs that might suggest that a patient coming in, that their nervous system and gut-brain axis might be out of balance?
Well, they're going to have gut symptoms, right? That gut issue. They may also have spinal symptoms, back pain, neck pain, headaches, etc. So, symptomatology might match up. I actually use scanning to test the nerve system. So we can do tests. I have a scanning system that tests temperature balance on both sides of the spine. Temperature is controlled by the blood vessels that are controlled by the autonomic nerve system. So the test can suggest and can see areas where there might be imbalance in the autonomic nerve system. Are they in a sympathetic dominant state? Are they in a low parasympathetic dominant state, et cetera? We use EMG. So EMG measures muscle tension on both sides of the spine, which really tells me, how much stress is their brain under, how much stress is their nerve system under, just holding their body upright and moving through gravity, right?
That's cool.
And HRV is well known to show if a person is in a HRV, being heart rate variability, to show what state their nerve system is. Is it sympathetic? Is it low in the high in the sympathetic, low in the parasympathetic, et cetera? Yeah. So we actually measure that, and if they have those symptoms match up, then it's a strong suggestion. Another way would be a person with gut issues that, like you said earlier, they're taking probiotics, they're doing an anti-inflammatory diet, they're doing everything under the sun to improve their gut or their immune system or whatever, and it's not fully resolving. Oftentimes, again, it's that neurological component that goes missed, undiagnosed, underdiagnosed, not thought about. Yep.
Yeah. Are there any specific adjustments? I know you were talking about your testing there, but how about in the interventions kind of realm? Is there anything any specific techniques that you feel are particularly effective, or things that you're kind of exciting about coming on the field a little bit more?
Yeah, I wouldn't say anything new. Again, with chiropractic is different in that way. We don't, um, we don't treat if someone has a gut issue and we're looking to, okay, where's that gut issue coming from, and treating that spot. It's not really how chiropractic works. We again look to find where's the areas of dysfunction, where's the misalignment, where's the irritation to the system, and then correct that. But I will say, of course, upper cervical region has the most influence on the vagus nerve because of where that exits through the skull.
Yeah.
Cervical spine in general, with whole displacements of the cervical spine, can create tension on that vagus nerve and disrupt its ability to function properly. And then there's the mid thoracic to low thoracic upper lumbar area that has direct autonomic nerve system fibers to the gut itself. So focus, looking in those areas particular, but no specific adjustment or technique that per se makes one better than the other. Although different patients in different states with their nervous system, some people might need a more excitatory, more oomph to their adjustment, or some people might need real soft touch because their nervous system's overexcited and they need a calming effect. So understanding that as well is important, to who you're dealing with.
Yeah, taking a personalized approach.
Yeah, nothing specific as far as gut issue, this spot, this adjustment. Yeah, it doesn't work. It doesn't work like that, unfortunately. Yeah.
Are there any things that we can do at home to help foster that those connections, like particularly in the cervical spinal area? I know that a lot of people carry their stress in their shoulders, and I'm sure that blocks down that pathway too. Is there things we can be doing?
One thing that's probably totally missing from our society, we're great at dental hygiene, but we're terrible with spinal hygiene. People know that it's a thing. So very basics would be moving your spine, really moving all joints in all of their ranges of motion every day. Movement improves neurology. Like I said, when joints get stuck, that creates abnormal signals, that creates abnormal neurology. So moving joints improves neurology. It also just, our brain gets energy from joint movements, particularly spine movement. So supplies energy to our brain. So movement, I think, is most important you can do. People should move their spine in each range of motion every day, and keep your spine as loose and moving well as possible.
So
and then there are, of course, posture exercises that can be done as well that people can learn on Google, learn online.
Yeah, YouTube's a great resource sometimes for that.
There are posture issues that there's not a generic. There are generic exercises people can learn, but there's also specific things that an individual person might need to really correct their problem, which is where a corrective chiropractor would come into play with that.
So maybe you can do a little, I've got a Mythbuster question here for you. I once heard that you're not supposed to do a lot of spinal manipulation, like don't do your heavy yoga class first thing in the morning. Is there truth to that? Or is it more like you need a little extra long warm up? Or have you not heard of that at all? Did I find that from somewhere?
I never heard that with yoga. I will say our spine is most stiff in the morning. And so movement in the morning is most important.
Okay.
Right.
So when it's most stiff, is it most also prone to injury? Or not necessarily? Yeah.
Imagine, yeah. When we lay down and sleep, the discs, the cushions in between our spinal bones, particularly, through the day, through what's called imbibition, nutrients go in and out, and fluid in and out of those discs in the night. When we're not moving, they swell up with that fluid or retain more of it, and that's why there's more stiffness in the morning. And everyone notices that. People are more stiff in the morning, and patients all the time will say, "Well, I'm real stiff in the morning, but as I get moving around, I feel better. Yeah, that's so that inhibition process is working for you.
You're also dehydrated in the morning, which probably doesn't help.
Yes, exactly. Yeah.
Yeah.
So movement, I think, in the morning is actually more important. Whether it's better to do yoga later in the day, I don't know.
Yeah.
Not a yoga expert, but definitely spinal movement. I prescribe spinal movements and stretches to all my patients, and they do it first thing in the morning. Yeah.
Yeah. Okay, cool. Can you tell us some of the things that you do to like that you've built into your daily habits that support your own physical and mental well-being?
Sure. Yeah. Number one, regarding mental, I would say relationship with higher power. For me, I'm Christian, so prayer and reading God's word. But for others that are not into that, maybe meditation and reading some positive affirmations, right? As far as the mental side, physical, I think what's really missing for most, and what I try to incorporate is spinal hygiene, is movement, is posture exercises, balance exercises, just general joint movement, all joints in my body that I move each day. And then I do all the, your basic stuff. I strength train. I am active with activities that I do outside of the house. I like to, do all kinds of mountain sports and water sports, and then I try to eat right, and I try to eat an anti-inflammatory diet. Yeah. But I think what probably most people are missing is that spinal hygiene component.
Yeah. Just to expand on that a little bit more, for those of us who can't get up and move all the time, sometimes you're stuck at a desk for a little while. Do you have recommendations around sitting desk type of chair, ball, standing desk, walking desk, or is it about all the variety?
Most people I've found do best with a sit-stand situation. You don't want to stand all day. You don't want to sit all day. A lot of people are moving to stools or exercise balls to sit on because it forces better posture. But I think an optimal situation is an option to sit and an option to stand, and then having the proper sitting
posture
and posture for that person.
All right, great. I'm doing that right. I've got it all, actually. I've got a standing desk or adjustable to sitting. I've got the walking pad down here. I've got a bench, the ball, and I just kind of float around through all of them throughout the day.
Yeah. Definitely the worst is just, they say sitting's the new smoking, right?
You're right.
Sitting all day, not getting up and moving. If someone is doing that, just get up and walk. Walk around your desk. I wouldn't sit more than 30 minutes to an hour without just getting up and moving your body.
Yeah.
And real simple movements that you can do, that just rotating and bending and your spine periodically will help with it as well.
Okay, great. Well, thank you for that. One thing that I just wanted to highlight from my point of view is a couple micronutrients that I often see are deficient in clients that have nervous system issues. So you can tell me if you agree or disagree with any of these, but the things that I like to highlight are the micronutrients, particularly the B vitamins, vitamin D, vitamin E, magnesium. Those are often really deficient, so making sure that those are optimized. And then the omega-3s and zinc and iron. Those are kind of the heavy hitters. A lot of them you can get from a high-quality multivitamin, in addition to eating an anti-inflammatory diet like you were mentioning. But those things are really going to give your nervous system the tools that it needs, the bricks that it needs to rebuild the cells and to keep those connections firing smoothly, which can often get broken down with deficiencies.
Yeah, I would fully agree with those. The B vitamins are most known neurologically. The proper fatty acids, because the myelin sheath is just fat. That's what surrounds the nerves, and that's what creates the conductivity. So those probably being the top two, I would say, maybe. But yeah, I agree with all of those. Absolutely.
Yeah. And as far as a specific recommendation for the omega-3s, I feel that a lot of the recommendations are lower than than are optimal. So I recommend 2 grams a day of a high quality fish oil. You really can't eat enough fish to get optimum levels of that without other baggage like heavy metals and stuff. So, and you guys can drop a comment down below if you want to know my specific recommendations, because there is a big quality issue with some omega supplements, especially once you start taking higher doses. So just making sure that you want to build those, like you were saying, those myelin sheaths out of high quality fats, because if you don't have those available, then it's going to use, the fats from the McDonald's meal that you had, and it's going to create your myelin sheath out of that. And you can imagine after those have been sitting around for a while, they get hard and stiff and not as pliable, and not the communications don't go nearly as smoothly with when things are built out of that kind of fat. So
exactly. Yeah. I had this young patient I've been working with, 18-year-old female, and granted, she had an accident months ago, maybe a year ago, and she didn't have proper care for it, and so a lot of that injury is settled in. She can't afford to do full corrective care, so we're doing a traditional approach with her, but she's not getting. She did, feel better for a bit after adjustments, but then is waning out of the symptomatic relief, and just really not, her levels of pain were just not coming down like a normal patient, over time. And I said, what is your diet like? And she said, well, I really love McDonald's. And she literally ate McDonald's 2-3 meals a day.
Oh, that'll hurt you.
I said, the reason you're not healing is, we're trying to allow your body to heal, which is really those damaged cells getting replaced with new healthy ones, and yours being replaced with McDonald's. Mm-hmm. And that's, you always have, in order for full healing to happen, you have to have the right nutrients in order to do that.
Yeah.
Any condition.
Yeah, absolutely. And then sleep is the other missing thing that we haven't talked about yet, but I know I just got to always give a shout out to sleep, because it's underrated, maybe not as much anymore, but that's when your body does a lot of this repair and regeneration too.
Oh, absolutely. And I've been recommending 1,000 milligrams of fish oil, so I'm going to increase to that 2,000. Mm-hmm. Yeah, this conversation.
Yep. The studies keep coming out in greater and greater support of a little bit higher dose. And the risk factors for supplementing at that level are so low. But the scope of benefits keeps building and building. So I'm more convinced than ever that, like, if you can only do one thing, I think that's a chart topper.
Now, there's some people with extreme inflammatory issues may need a therapeutic dose, which is, I believe,
even more.
Yeah.
And that you can get into, those are prescription levels. You'd want to, be working with a practitioner if you feel like you need those levels of therapy, to be checking your blood levels and adjusting from there. And then you can get even more highly refined EPA and DHA supplements in different varying ratios and stuff. So, but you'd be working with somebody who's well-versed at that. But you're right that people do go much higher than the 2,000 in therapeutics. Kind of like same with vitamin D. Whenever I recommend, 5 or 10,000 of vitamin D, people are like, whoa.
Yeah.
but the scale's way off. So that's those two for most people.
Yeah, those two when they're deficient.
Yeah.
Extreme health issues, and might need high dosage for a short duration.
Yeah. And then I'm a fan of test, don't guess also. So for me and my clients, we check quarterly or semi-annually to see where those levels are at, especially with, closer to therapeutic doses, to make sure you're in the right range and not going too far over taking 10 pills when you only need to take 5.
Yeah. Well, in your line, you have to test.
Yes.
Right. Yeah.
Yeah.
Not all chiropractors test. I think testing is important, but you guys have. Yes, for sure.
It's always helpful to have numbers also. It hits home a little bit more for your clients, especially when, you're making changes that aren't, I mean, habit change is rarely easy. So if you have more hard data, it feels a little bit easier because you can see where you're going when some of the benefits might be a little bit under the radar from a symptomology perspective. So
yeah. I actually, I on my examination, I do 10 to 15 different tests on patients, and then I actually score, out of 100, where are we at? And then I can give recommendations that are based on clinical research as far as what is it going to take to improve this condition, not necessarily symptomatically, but actually improve the condition. And the great thing, anytime we improve structure and function and reduce stress on the nervous system, the scores go up. And whether it improves their symptoms or not, sometimes, most of the time it does, sometimes it doesn't, but you can't improve structure and function in neurology and something not be better in your body. It's just not possible.
Yeah. That's the hard part about root cause resolution, right? Is that some of these things that we're making better don't seem obvious of how they're being made better. But it's like the problem of how do you sell somebody on a disease that they didn't get?
Right.
So it's hard to contextualize, like, well, if you didn't make these changes, then you would have gotten this disease. But that's, too abstract. And there's, of course, no way to prove that. But a lot of times that is the reality.
Yep. And healing's not up to us.
Right.
It's not up to the practitioner. It's not up to the person. It's up to their body.
Yeah.
And, their body might need, they might be coming to us for back pain or gut issues, but their body needs to heal. Maybe there's cancer growing inside them, or something else that's on a higher priority. The body's going to heal the highest priority first. Know what that highest priority is all the time.
Yeah, absolutely. Well, Dr. Ringer, before we sign off, could you please share with our listeners how they can connect with you and learn more about your practice and what you're doing?
Lakeside Spinal and Wellness. We're in Renton, Washington. There is one in Chicago. We're not affiliated with them. They look like a great spot, but that's not us. Phone number is 425-264-3173. And our website is lakesiderentonchiro.com.
All right. Well, thank you so much. And thank you all for listening. I hope today's conversation with Dr. Winger has inspired you to take control of your own health journey. Remember, whether you're looking to rewrite your health script or add unscripted chapters to your journey, we're here to guide you. So if this conversation sparked any questions, comments, or suggestions for future episode topics, we'd love to hear it. So drop a comment below or find us on social media at wellness.unscripted. Don't forget to subscribe for more health tips and inspiration. And if you'd like to learn more about me and my clinic, visit unscriptedclinic.com. Thanks, everyone. Bye.
The content provided in this podcast is for informational and educational purposes only and does not constitute medical advice. Always seek the guidance of a qualified healthcare provider with any questions you may have regarding your health or a medical condition. The host and guests are not responsible for any adverse effects from the use of this information.